specialists say that we are starting to see evidence that opening up the country may have hidden health benefits very important to families and especially children. Medical reporter Liz Bonus explains why.
For weeks, the country has been shut down, concerned about the spread of the COVID-19 coronavirus and its impact on lives. Now, as businesses in the country begin to reopen,
some people say, listen, lives can't be replaced, businesses can. But others are saying businesses affect lives. And so it's all the same thing. And we have to weigh these trade-offs.
These trade-offs, according to Katy Talento, an epidemiologist and former policy advisor for President Trump, are showing up in other ways. For example, this week, Job and Family Services workers in one Ohio community who track child abuse reporting said when the state shut down mid-March, the number of total intake calls went from 320 to 146 by the end of April. Now, as we encourage kids to see doctors and go back to child care, those calls are back above 200. Public health specialists say that's a good thing.
The sad fact of the situation is always that home is not always a safe place for kids. And during this pandemic, when people have been holed up, some of the factors that lead to child abuse in the first place, substance abuse or mental health disorders, get exacerbated by that. People don't have the stress relievers that they might have had normally. And those things can lead to very, very bad consequences.
Those consequences also being seen by those who monitor public health and safety.
Okay.
The crimes that are starting to trickle up are a little domestic violence, and people are starting to get on each other's nerves. And families, you would think families wouldn't fight with each other, but that's not the case. And as this goes longer and we get involved with alcohol and drugs, so they tend to fight a little more.
That fighting, drugs and alcohol use can cost lives in other ways.
There are statistics that for every 1% increase in unemployment, you have 1% increase in suicides. So that alone is a very alarming statistic.
Which is why Katy Talento says it needs to be balanced against the risk of catching the coronavirus. I'm medical reporter Liz Bonus reporting.